Health and education bills in the following order. S. 1840, the Screens for Cancer Act, introduced by Senators Baldwin and Collins. S. 3392, the Advancing Research and Education Act, introduced by myself and Ranking Member Cassidy. S. 3393, the Support for Patients and Communities Reauthorization Act, introduced by myself and Ranking Member Cassidy. And S. 644, the Modernizing Opioid Treatment Access Act, introduced by Senators Markey, Paul, Lujan, Braun, and a number of other senators. Let me take this opportunity to thank both the Democratic and Republican staff for their very hard work on this legislation. The bills that we will be discussing and voting on today will invest in early detection programs for breast cancer and cervical cancer, will invest in high-quality educational research, will invest to expand access to methadone and to respond to the opioid crisis that is plaguing our nation. And let me begin by saying a word about the reauthorization and expansion of the Support Act. Sadly, I don't have to tell anybody in this room, whether it's in Vermont or any other part of our country, that we have a horrendous opioid crisis, something that Congress has got to address. Last year, over 100,000 Americans died from overdoses. Some 70% of those tragic deaths involve fentanyl and other synthetic opioids. The major obstacle, in my view, that we have had to effectively go forward on this bill had to do with the amount of money that we should appropriate. My own view has been that we cannot adequately address this crisis without investing more federal resources into our communities to hire more substance abuse counselors and mental health professionals. I think it's no secret. I don't think there's a state in the country that has enough mental health professionals or substance abuse counselors. And that is why I'm proud that this bill authorizes a 70% increase in funding to train more mental and behavioral health professionals in America, and a 25% increase in funding to provide student loan forgiveness to counselors who agree to practice in underserved areas. I'm proud that this legislation provides an 80% increase in youth prevention and recovery services to expand peer-to-peer substance abuse prevention programs in our nation's public schools, among other things. This legislation will also increase funding for the National Child Traumatic Stress Initiative, a longstanding program that supports community-based trauma treatment and services to children and families nationwide. This bill will ensure that our nation's first responders will have the critical training they need to address overdose and substance use disorder crises. So I would conclude by saying that we're making progress, but given the nature of the crisis that we face in overdoses and opioid addiction, we still have a lot of work to do. In terms of the methadone bill, one of the things, in my view, that we can do to address this crisis right now is to expand access to methadone. That is why I'm pleased that we will be marking up Senator Markey's Modernizing Opioid Treatment Access Act that he has worked on with Senators Paul, Lujan, and Braun. In America today, the only way to get methadone is through a certified methadone clinic. Unfortunately, 80% of the counties in our country do not have a methadone clinic. As a result, the only way millions of patients in America can get the methadone they need is to drive long distances to get that treatment. Senator Markey's bill would respond to this crisis by allowing certified providers to prescribe methadone to patients for opioid use disorder and to allow pharmacies to dispense methadone in up to 30-day supplies. According to the NIH, patients being treated with methadone are over 50% less likely to die of an opioid overdose than those who are not using methadone. Let me say a word about the Screens for Cancer Act. Another bill that we'll be considering is the Screens for Cancer Act, led by Senators Baldwin and Collins. This bill reauthorizes the National Breast and Cervical Cancer Early Detection Program, which provides screening, diagnostic, and treatment services for underserved populations. Over the last 30 years, this program has served more than 6.2 million women, detecting nearly 78,000 breast cancers and over 24,000 precancerous breast lesions. The program has not been authorized for over a decade, and I appreciate Senators Baldwin and Collins' leadership in moving this bill forward. And then we have the Education Research Bill. Last but not least, we'll be marking up the Advancing Research and Education Act. This bill will ensure that high-quality and timely research gets into the hands of teachers and principals. For over 20 years, the Institute for Education Sciences has funded valuable research and generated statistics on the current state of our nation's education system. Because of this work, we know our students and teachers are facing more challenges, perhaps, than ever before. We know that college enrollment has declined by 15% over the past decade. We know that the U.S. ranks 4th in reading, 6th in science, and 22nd in math scores for 15-year-olds compared to 37 other major OECD countries. We know that almost half of public schools in this nation say they cannot provide the mental health services that their students need. This legislation will create a program to help states track student data and outcomes from preschool to college so that we can identify gaps and opportunities for young people. It will expand the research capacity of historically Black colleges and universities, tribal colleges and universities, and other minority-serving institutions. And it will help develop a more reliable and accurate measurement of student poverty to ensure funding and resources accurately reach the most vulnerable students in our country. I support these bills, and I believe that they should be signed into law as soon as possible. Senator Cassidy, you are now recognized for an opening statement.
Thank you, Chairman Sanders. I too want to thank the staff. They've worked nights, they've worked weekends. Whenever I call them, no matter what time I call them, they're taking the call. They're on it. If there's an emergency, if you will, kind of what is about this, they're all about it. So I just want to once more acknowledge staff. Today, the committee will consider legislation reauthorizing programs crucial to addressing our nation's opioid epidemic and improving education research. I appreciate the chair and the rest of the committee for their work in getting these reauthorizations through the committee. It is our responsibility, our collective responsibility, to properly evaluate and improve these programs so that they work properly for those who depend upon them and are an effective use of tax dollars. Congress can continue to extend funding for expired programs, but neglecting reauthorization prevents changes in policies. We also need to address programs to know whether or not they're working and meeting their full potential. One important piece of legislation we'll be examining is the Support Act. It expired at the end of September. This legislation responds to the opioid and fentanyl epidemic, focusing on prevention, treatment, and recovery for those with substance use disorder. It reauthorizes funding for residential treatment programs for pregnant and postpartum women, training for first responders, resources for individuals in recovery re-entering the workforce, programs to support children and youth mental health. The opioid and fentanyl epidemic is devastating communities and American families. Thousands of Americans dying each month from an overdose. That's why reauthorizing and improving the Support Act is so important. I'm glad we're doing this today. The committee is also considering the Advancing Research and Education Act, which would reauthorize the Education Sciences Reform Act, or ESRA. Sounds like a rock band from a few decades ago. ESRA expired in 2008. This legislation applies that what we've learned about education research over the past 20 years. It improves education research at the Institute of Education Sciences, and it enhances evidence use in the classroom and the dissemination of that to improve students' academic outcomes and to address concerns we've heard both from researchers and education leaders. I thank my colleagues for your collaboration. I look forward to today's markup.
Thank you, Senator Cassidy. We'll now begin consideration of 4 bipartisan bills for the awareness of all senators and staff. We intend to roll all votes until the end, and we will keep members and staff updated on the timing of votes. I'd also like to ask my colleagues to limit remarks to 2 minutes. We'll now consider S. 1840, Screens for Cancer Act of 2023, and we have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it be considered original text for the purpose of further amendment. All those in favor, please say aye. Aye. All those opposed, say nay. The ayes have it, and the motion is agreed to. Are there any members who wish to speak on or offer an amendment to S. 1840?
Mr. Chairman.
Yes. Senator Baldwin.
So I want to thank you and Ranking Member Cassidy for adding the Screens for Cancer Act to this markup agenda. I have been really proud to work with Senator Susan Collins on this effort to reauthorize the National Breast and Cervical Cancer Early Detection Program. I led the last reauthorization effort when I was a member of the House of Representatives back in 2007. So this is clearly long overdue, and it's an important step in our fight against breast and cervical cancer. With this legislation, we are saving lives, and I encourage my colleagues to vote in support of the Screens for Cancer Act. I also want to take this moment, instead of seeking recognition before all the bills come up, to mention an issue surrounding the Support Act reauthorization package. First of all, it's just critically important that we step up to respond to the opioid and substance use disorder crisis, including as it evolves. And I want to just stress that point. I have introduced an amendment that would give public health laboratories the ability to better detect and monitor not only opioids, but other harmful substances as they emerge. However, given the language that I secured to reauthorize the Overdose Data and Action Program to give states flexibility to look at risks associated with all types of substance use and allow work on emerging substances of concern like xylazine, I will withdraw my amendment when that bill comes up. And finally, I wanted to take a moment to address an education amendment that I expect to come up later in this markup. Anti-Semitism has no place on college campuses or, frankly, anywhere. And I share the concern of my colleagues on both sides of the aisle about the startling rise in anti-Semitic incidents following Hamas's horrific attack on October 7th. The Department of Education should exercise aggressive enforcement action against entities that fail to meet their obligations to protect Jewish students. I am concerned with the wording that Senator Marshall's amendment will create an ambiguity regarding the department's enforcement authorities, but I hope we can work together on perfecting the language of that amendment moving forward. And with that, Mr. Chairman, I would yield back.
Thank you very much. Are there any other members who wish to speak on or offer an amendment to S. 1840?
Mr. Chairman.
Senator Collins.
Thank you, Mr. Chairman. Let me start by thanking the chairman and ranking member for including our bill in today's markup. I especially want to recognize and salute Senator Baldwin for her leadership on this bipartisan bill to renew the proven National Breast and Cervical Cancer Early Detection Program. It provides thousands of uninsured and underinsured Mainers with breast and cervical cancer screening, diagnostic, and treatment services each year. Our bipartisan bill would reauthorize and strengthen this life-saving program. Over the past 5 years, this program has helped nearly 5,000 women in Maine receive a total of more than 12,000 screening tests. This screening helped to detect 64 cervical cancers and found 108 breast cancers. One of the women who benefited from this program is Bethany Zell of my hometown in Caribou, Maine. When she visited my office earlier this year, she told me that she never would have guessed how much this program would affect her life. As a self-employed independent contractor, Bethany was uninsured and turned to the program to have her mammogram covered in May 2023. Ironically, this was a program that she knew well for her years of advocacy. Never would she have guessed that it would end up benefiting her. In a time of much anxiety and fear, Bethany said that this early detection program not only helped her get diagnosed, but also guided her from diagnosis to treatment and every step in between. The final point that I would make is the National Institute of Cancer tells us that the screening rates declined dramatically during the COVID pandemic, and this legislation is very important to help us make up that lost ground. Thank you, Mr. Chairman.
Thank you, Senator Collins. Any other members who wish to speak on S 1840?
I'll speak briefly.
Senator Cassidy?
I strongly support this, and I thank Senators Collins and Baldwin for their leadership. You know, every now and then your past life intersects with your current life. My wife's a retired breast cancer surgeon, and she would speak of women lacking insurance who had no way to get screened, and finally they would have a lesion in their breast, fungating out of their breast. Fungating, if you imagine a mushroom coming out of your breast. And it would be late stage, and it would be very difficult to treat at that stage. So this program, with its potential to prevent that, is where we intersect with the lives of those whom we have the privilege to represent in the most powerful way. So I urge my colleagues to support.
Okay, further discussion? Okay, this concludes a consideration of S 1840 and its amendments. We'll now consider S 3392, Advancing Research and Education Act, and we have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it be considered original text for the purpose of further amendment. All those in favor say aye. Aye. Those opposed say nay. The ayes have it, and the motion is agreed to. Are there any members who wish to speak on or offer an amendment to S 3392? Senator Hassan.
Well, thank you, Mr. Chair, and thank you, Ranking Member Cassidy, and your staff for your work on this important bipartisan legislation. I'd like to speak to and then withdraw Hassan Amendment Number 1 to S 3392, the Advancing Research and Education Act. This amendment is based on the Bipartisan Mathematical and Statistical Modeling Act, a bill I co-lead with Senator Blackburn. Results from the National Assessment of Educational Progress released this summer show that math performance has declined to its lowest level since 1990, putting our workforce readiness at risk. My amendment would help modernize math education by directing existing funds at the National Science Foundation toward researching ways to improve primary and secondary school math education. This bill received a unanimous committee vote in the House and would not affect direct spending. While I will not request a vote on the amendment at this time, I will ask for the chair and ranking member's commitment to work with me on moving this legislation forward. Thank you.
Other amendments?
Mr. Chair?
Yes, Senator Smith.
Thank you, Mr. Chair. I don't have an amendment to offer today, but I want to just take this opportunity to thank you and Ranking Member Cassidy and your staff for your work on this bill and this effort to make our educational research enterprises more responsive. And I especially want to note and be appreciative of the work done to create these data innovation grants to help develop alternative measures for poverty. So we've known for a long time that when we rely on the free and reduced lunch forms as a proxy for measuring poverty, that is very imperfect and inefficient. And as more states like mine that are taking action to provide universal school meals, parents aren't filling out these forms. And so we need a better way to measure school and district level poverty. So I strongly support this work to include the data innovation grants in this bill. And I also want to thank you all for the work that we've done to include additional language to make sure that we are not undercounting Native American students. Today, when the federal government counts Native American students who are multiracial, acknowledging, of course, that this is not interchangeable with a political or legal status, but when students are counted as multiracial, that sometimes obscures or undercounts those students, which is a problem. So I appreciate very much we're tackling this issue, and I'm grateful for your work on this. Thank you very much.
Thank you, Senator Smith. Further discussion or amendments?
Mr. Chairman.
Senator Marshall?
Thank you, Mr. Chairman. I'd like to pull up Marshall Amendment number 2, to provide that no funds may be provided to an entity that allows anti-Semitism to occur on the campus of such entity. Hate has no place in America, let alone in our schools, yet we've seen anti-Semitism rise at an appalling rate since the horrific attacks against Israel, the people of Israel, on October the 7th. The term anti-Semitism is too soft. It's too sterilizing. What we're really seeing is Jewish hate. What we're seeing is Jewish hate. The school day should be a time where students should be able to learn and interact with their peers and teachers without the threat of violence or hate. This amendment will help combat anti-Semitism in schools by preventing funds from going to schools who have gone against their Title VI duty under the Civil Rights Act and allowed Jewish hate to occur on their campuses. It's unthinkable that schools wouldn't uphold their obligations, but we've seen troubling signs that schools are putting Jewish students in harm's way. Just last week, across on the other side of the Capitol, 3 presidents from 3 prestigious institutions couldn't denounce anti-Semitism. This amendment will send a clear message to our schools that the federal government will not tolerate allowing hate of any sort to any group of people to run rampant across the campuses. Thank you, Mr. Chairman. I yield back.
Okay. Further discussion? Let me respond by saying this. I would hope that every person on this committee will do everything they can to combat the very significant rise in anti-Semitism. We had a classified meeting last week, and what we heard from the FBI and other agencies is, in fact, there is a very, very significant spike in anti-Semitism throughout this country. And I look forward to working with Senator Marshall and every member of this committee to address not only anti-Semitism, but racism, Islamophobia. I don't know if you know, Senator Marshall, in my city where I live, a mile away from where I was, 3 young Palestinian students were shot. We have racism against people of Asian origin. It is bigotry in this country is a long-standing problem, and I hope and believe that every member of this committee wants to do everything we can to combat it. But I think this amendment, Senator Marshall, deserves more work, and I would look forward to working with you on this issue, but I think this amendment, which was, I think, just offered yesterday, if I am correct, has not really been vetted effectively. Would you be willing to withdraw it and work with us to improve it?
Give me a few moments to
Okay. I mean, you're on to an issue of
to
importance.
contemplate that. And certainly I condemn Islamophobia. My heart pours out to the 3 Palestinian folks that were murdered.
No, they weren't, thank God, they
Yeah,
were
thank
not
God
murdered.
Oh, they were murdered. Okay.
No. 3 of them were shot, 2 of
just
them were
shot.
recovered. One,
Okay. I knew that
we believe, will be
in Burlington.
paralyzed.
I saw that. I think if I could just call on all religious organizations to condemn these. If you're a Jew, you should be condemning
Absolutely.
this. If you're an Islam leader, you should be condemning anti-Semitism as well. And we as leaders need to condemn this.
We do.
And this is a way to put teeth behind the actions that I think that are not being enforced. So
I take the issue seriously. I think every member of the committee. I think that amendment needs a little bit more refinement.
Mr. Chair?
Yes, Senator Hassel.
I just wanted to echo a little bit of what you just said. I understand the intent, Senator Marshall, behind these amendments. I have concerns that as currently drafted, they could have significant unintended consequences. I really support the goal of preventing malign influence from foreign actors such as Russia and China on school campuses, and I'm deeply committed to your goal of ensuring that places of learning are free from anti-Semitism. But I am a little concerned about the lack of time we've all had to work on this, and I just would echo the chair's request that perhaps we could work a little bit further before voting on them.
Mr. Chairman,
Senator Collins.
as I look at this amendment, I don't see why it's that complicated. It reminds me in many ways of the exchange that we witnessed on the House side last week when the 3 university presidents could not bring themselves to condemn anti-Semitism in the threat of genocide. And we already have Title VI of the Civil Rights Act. We're not writing a new law in this area. So I guess I would be interested in knowing what is the complexity that concerns those who have asked that we wait.
Mr. Chair,
Yes, Senator Kane.
if I could respond to Senator Collins, this is a good discussion. I think the phrase, any institution that allows anti-Semitism is too broad. On the University of Virginia campus, there was a permit allowed for a march, and the march devolved into chants of Jews will not replace us, et cetera, et cetera. That was not what the campus wanted, but it was what happened. A dumb, naive 18-year-old could say something that someone could perceive as anti-Semitic. Does the university lose all funds if a student is allowed to say something? You could think of different instances. You know, if a professor is preaching, you know, anti-Semitism as part of the curriculum, that's a different one. But the allowing anti-Semitism on campus, which isn't really defined what allow means, could be potentially so broad that it could trip up a lot of instances, even on a campus like the University of Virginia, which has been scarred by anti-Semitism. So I think the issue might be first to consider whether we should, you know, have an indictment of anybody who's targeting someone because of their religion, not just because of anti-Semitism. But secondly, we might define what allow anti-Semitism is in such a way that would differentiate between behaviors that a university may not have known were going to happen, but then happened on a big campus, versus things that are really having kind of the imprimatur of the university. And I think we would probably all want to get on board with something that could define what allow anti-Semitism means.
Senator Cassidy.
I don't know. I'm pretty sympathetic to the amendment. And I say that because we've heard testimony, and not a committee hearing, but a panel, where a young woman from Stanford spoke about how in her K through 12 organization school, there was a poster put up of the oppressed and the oppressor, and that Israel was put up there as the oppressor. And that was kind of a indoctrination, so that when they go to Stanford, all these students are so hostile towards Israel and through Jews through a process which had begun in K through 12. I think we would be having our head in the sands if we didn't see that there had been this kind of infiltration of our institutions of K through 12 and higher education that kind of depicts Israel and Jews as kind of the oppressor. And that has created this kind of intellectual environment where we now have kids being locked in a library to protect them from other kids who are banging on the door. To your specific example, if it was well documented that at the outset of the march, it was not anti-Semitic, and then it broke into something, that would be like saying at a football game where there's a fight, you're reliable for the fight. No, you had a football game, and 18-year-olds who behaved inappropriately changed it into something which was different than what had started off. We encounter that situation commonly. So I don't mean to minimize concerns, but I also don't want to minimize the kind of understanding we have of the current events. I also want to point out that it would begin to use the same definition of anti-Semitism that the State Department currently uses. It broadens it relative to what the Department of Education uses. And so it would bring in harmony how our government is addressing and defining anti-Semitism.
Further discussion? Okay.
Mr. Chairman?
Yeah, Senator Cassidy. Senator Marshall.
That's right. Looking forward to Thursday's calendar, would it be germane to offer the amendment then? And if someone could help me? Probably not.
It's a hearing, Senator Marshall.
Oh, it's a hearing. My bad. Okay. I guess my closing remark would be this, is someone on Capitol Hill needs to stand up and show the courage to do the right thing. And I would ask my friends across the aisle if, applying the situation equally to all groups, if this was a group of gay people that were being just hated on, if this was a group of people with a different skin color would be hated upon, would you have the same opinion of this amendment? And Senator Collins makes a good point here. If we change the word from allows to promotes, would that change?
Again, let me just suggest this. I know where you're coming from. You're coming from the right place. I think we need a little bit more time on it. I think, in a sense, Senator Cassidy raised the issue, how do we define anti-Semitism? The current government in Israel is not a popular government. According to polls, 70, 80% of the people get rid of them. If you criticize the government of Israel, are you being anti-Semitic? Well, obviously not. But could that be interpreted to be that way? So I think we need a little bit more work on this. All right, further discussion.
I'm just going to say,
Senator Romney.
I'm very much in favor of finding ways to end anti-Semitism and other forms of hatred on campus. I, for one, have some difficulty in being able to draw the lines between anti-Semitism and political thought. I mean, so for instance, if you're opposed to the creation of a Palestinian state at all, or if you're in favor of a two-part solution, a two-state solution, as I am, could that be considered anti-Semitic? I mean, calling for getting rid of the settlements in the West Bank, is that anti-Semitic? I find this a difficult topic. I know what anti-Semitism is as we have experienced it around us in this country, but I haven't read the amendment carefully enough or had my attorneys read it to assess whether we've come up with a definition that protects, if you will, political thought, and at the same time punishes anti-Semitism. I also just wonder what happens if students do really stupid things and say stupid things. Must they be expelled or just have their wrists slapped? I mean, likewise, a faculty member. If a faculty member says something, is a requirement that in order to receive any federal funding at all, they must be expelled as faculty members? I'm sort of curious as to how this all works, but I like my other colleagues, I feel we need to take action to end the anti-Semitic attacks, but I don't know that we've, not having studied this thoroughly enough and had, if you will, the jurisprudential magnifying glass, I'm not sure that I know exactly where I want to come out on this particular amendment.
Further discussion.
I think Marshall's amendment is somewhat pretty straightforward. I mean, we try to get in the weeds because we overthink things, which is okay because we don't want to leave it up for chance, but his amendment is specifically saying that the university embraces it. He specifically used the example of the three presidents of the university that refused to call out anti-Semitism for what it was. I messed up on the word, didn't I? But I need to eat. But I mean, it's pretty clear. If the university embraces it and doesn't denounce the behavior of a professor, or doesn't denounce the behavior of the student body that is embracing this, that's doing the chants, then we shouldn't be funding it. And I think
is denouncing it enough, or must they fire the people who do it?
I don't think it said anything about it. It's the university embracing it. It's the university embracing it. Well, how they choose to handle their own affairs is up to them, but do they embrace it or do they not? Do they allow this to happen on their campus, or do they not allow this to happen on their campus? And the amendment is straightforward, which is why I think we ought to vote on it.
Well, but let me just come back and say the term embracing. I don't believe the language says embrace.
No, it says allows is the
Well, okay, allows is the same thing as embracing. I don't know how many times we.
Well,
no,
it is too.
This is the law. This is the law. All right, I'm a lawyer,
Okay,
and words have meaning.
Okay,
all right?
Reclaiming my time.
One at a
Reclaiming
time.
my
Senator
time.
Mullen.
Allowing something is the same thing as saying we're going to support this. If we're going to allow this to happen on our campus, we're going to support this.
Well-
That's allowing it. It's saying if it happens and coming out and saying, hey, we don't support this, that's not allowing it. That's not saying the university does it. That's just saying we don't allow this to happen. We don't support this in our university. It's pretty clear.
Okay, Senator, yeah.
Let me suggest that allowing something does not equal supporting it. There's all sorts of stuff that's said in classes and by faculty that the university doesn't support. And in a free society with the First Amendment, people are allowed to say objectionable things. That doesn't mean they support it necessarily. Also, the term embrace isn't there. I guess the question is, what does allow mean? So if a university says, we don't support what terrible thing was done on campus, is that enough, or do they need to remove people? I'd suggest they need to remove people. That's my view, but I think we need to define some of these things. My own view. I mean, just saying, because I do not believe that allowing is the same as supporting.
Mr. President?
Yes.
Oh, it was.
Senator Smith.
I would just observe, Mr. President, that this conversation illustrates that people of good intentions could easily misunderstand or not be sure how to apply the language in this amendment, and I think it illustrates why it would be a good idea for us to take some additional time to figure out what we all mean.
Senator Casey.
Yeah, but I guess I wanted to ask a question to Senator Marshall. I think what was so offensive last week when those university presidents, including Penn, were speaking was it was offensive in two ways. It's what they said and what they didn't say. And it seems to me that it centers on this question of a code of conduct for an institution of higher education. Every institution of higher education should have a code of conduct that addresses anti-Semitism. Some do, some don't, some do it better than others, but that ought to be the standard. And I don't know if you're trying to get to that. And the second thing I would add is, one thing that I was reminded of in a briefing that the committee had last week was this question of when the Department of Education engages in an investigation pursuant to a complaint from someone on campus, the Department of Education under Title VI, among other things that it does a rigorous review using, and this is a term from discrimination law, hostile environment. In other words, if they can make a determination that there is a hostile environment on the campus for Jewish students because of anti-Semitism, they have a sanction. There's a finding. Is your amendment directed at that, trying to make sure that on every campus that the code of conduct addresses it and that they're addressing it more generally? I just am not sure what allows, how that gets to this. So can you speak to that?
Well, I'll do my best. I'm not an attorney. and sometimes we do need attorneys to help us get the wording perfectly right. I think, number one, the amendment specifically cites Title VI to show what schools would be in violation of. I do think that the word promotes would be a better word to use than allows. I do think that, as I hear this conversation, that would be better language. And it would, parliamentarian, are we able to make that word substitute in this or not?
But
under the circumstances, we're not. Okay.
Can I follow up?
Yes, sir.
Why wouldn't a second-degree amendment be in order?
It would require unanimous consent.
I'm sorry.
It would require unanimous consent to make that change.
Okay. Senator Casey.
Yeah, just one question, Roger. I was wondering, in other words, the way this amendment will work is that there would have to be a finding by the Department of Education pursuant to Title VI to have this go into effect. Is that the way you understand it?
Yes. So in my opinion, that's a yes. And I would just mention this, that the text is broad, but it gives the Department of Education still has to adhere to the existing laws, as Senator Collins stated earlier. And the scope of meeting those thresholds is determined when the regulatory authority, within the regulatory authority of the administration. I just would sum this up that it's time for us to lead on this. I don't know that we have the time. These students that are being hated on need to know that the United States Senate supports them today, not next year. I don't see any opportunity to address this between now and next year.
Yes, Senator Murkowski.
Mr. Chairman, I'm glad that the author of this amendment, Senator Marshall, is looking at this and saying, yeah, promoting this behavior is different than allowing something to occur. I mean, we all know situations where you think you know what the guidance is, but spontaneously something happens, and then you have to deal with it afterwards, to Senator Romney's point. But in the meantime, could you get trapped into this because you have allowed this to occur? You have allowed that individual to be there. The other thing that I just might note, we're talking about this in the context of higher education, citing to the examples that we have seen recently. But in the definitions, we are including not only institutions of higher education, but also in our elementary schools, including charter schools, secondary schools. And so when you think about a situation that just may occur in an elementary school, for instance, again, not something that the administration would support, but just happens to allow it to occur, and then you're in this situation where you really do have some considerable consequences there. I agree, though. This is something that is important to message, that is important to make clear that we in Congress do not support anti-Semitic statements, acts, occurrences in our educational institutions, but how we do it, I think, actually matters. I would hope that the sponsor of the amendment could modify his own amendment.
Further discussion.
Bernie.
Senator Cassidy.
I ask for unanimous consent to allow the change Senator Marshall request, which is to change the word from allow to promote.
Well, I'm going to object for this reason. Promote is a stronger word, no question about it. Allows too much. But again, I think as we've heard today, and I'm not a lawyer either, Roger, but this is a legal question. I know that you support the First Amendment, and how we best proceed, I think, needs a little bit more discussion. Further discussion. Okay, with that, let's move on to...
More amendments, Mr. Chairman?
Yeah, I'm sorry, other amendments on this. Yeah.
Yes, Romney Amendment number 1 is pretty straightforward, which is it would direct the Statistics Commissioner of the National Center for Education Statistics to collect data pertaining to student smartphone use. I would like to acknowledge that and request that Senator Kaine be added as a co-sponsor of this amendment. I thank him and Senator Cotton for their bipartisan support of this issue. It's basically to collect data and understand what impact the smartphone use is having on our students. Some 60% of American students have self-reported that they are spending over 4 hours per week on their smartphones in a non-educational manner, and to understand what impact that might have psychologically and academically is something which we would task the commissioner to evaluate and to gather data on. This is not to make recommendations, it's just to gather data. The Second Amendment, Romney, number 2, also I'd like to ask, request that Senator Kaine be added as a co-sponsor. It asks the same research to be carried out on the use of smartphones during instructional hours. So the first deals with use of smartphones outside of instruction hours. This one deals with the use of smartphones during instructional hours. There are several states and schools that are now implementing smartphone bans during school time. And to understand what the impact of that is, just gather the data. We just want to get a chance to see the data of what they're doing and what the results seem to be. So this is looking for information, no prescriptions, simply information. Thank you, Mr. Chairman.
Thank you. Discussion.
Mr. Chair.
Yes.
I very much appreciate the amendment and appreciate working together with Senator Romney's team. The nice thing that's going on right now is enough school districts are doing this that you actually have the ability to compare schools with schools that aren't and then find best practices. Even in my home town of Richmond. There's about 25 schools in the Richmond public school system. 6 schools have embraced this, and they're going to run a comparison and test learning loss and student mental health kind of between those that are doing it and those that aren't. And I think taking advantage of this experiment that's going on nationally and gathering the data makes great sense, and I'm happy to be a co-sponsor of this amendment.
Further discussion? Senator Mullin?
How's the data collected?
How is it collected? That's something that the Statistics Commission or the National Center for Educational Statistics would be required to collect the data, but doesn't suggest how he or she collects it.
Is it going to be collected off the phone? I mean, are they going to be tracking the usage of the person's phone? I think that's, I mean, I don't want my kids' phone being tracked, especially by the commissioner. I'm just asking the question.
No, they're not collecting the information
How do we
by
know that?
tracking people's phones, because my staff just sent me a note that said no.
But it's the same thing. If this thing is too
Well,
broad.
this isn't authorizing something which is not legal now. It's not legal for even the FBI to track kids' use and track their conversations on phones without a warrant.
But we're allowing the
Judge.
commissioner to
collect data, but we're not- we're not
how's that being collected? That's all I want to know, is how specifically it would be collected. I think that's, I don't want, I'm just telling you, I have 6 kids. I'm really not open to allowing someone to collect the data on my kids unless I'm authorizing it to be done. And this is pretty vague and pretty open on what it says, and so I think it needs to be a little bit more specific on exactly how that's going to be collected and what we're authorizing them to do.
Let's see what I've learned here. Well, it says data on smartphone, both policies in schools. I don't know what that sentence means. That's not a sentence, so I'm sorry. Pardon?
Mr. Chair.
It's not looking at use, it's looking at policies. It's gathering information on school policies, not individual students. It's gathering information on the policies of schools and then comparing the performance of students, not tracking individual students.
That's all. Perfect.
Great, thank you.
Okay. Senator Collins, did you want to add to that? Or? Further discussion? Look, I think every parent here or grandparent understands the incredible impact that these phones have had on the lives of our kids and grandchildren. And I think we need as much information as we can. I think Senator Romney's amendment is a step in the right direction. Okay, other amendments? Yes, Senator Lujan.
Thank you, Mr. Chairman. I would like to offer and withdraw Lujan Amendment Number 1 to the Advancing Research and Education Act. First of all, I want to say thank you to Mr. Chairman and Mr. Cassidy, our ranking member, and the committee staff for working with me to include a number of priorities in this bill to increase diversity in and access to education research, including for tribes, Native Hawaiians, the Bureau of Indian Education, and tribally controlled schools. But I urge the committee and my colleagues to work with me to strengthen our efforts related to Native American languages, on which there is precious little research supported by the federal government. For over 100 years, the United States poured enormous resources into the federal Indian boarding schools to strip Native children of their identities and languages. Since 1990, the United States has only invested just over $300 million total in recouping the very Native American languages it tried hard to eradicate through these shameful policies. Over 90% of Native students attend public schools, and today 1 out of every 4 Native students in 4th or 8th grade has no exposure to Native American language. The Institute of the Institute of Education Sciences serves as the research and statistics arm of the U.S. Department of Education, and right now there is no requirement for it to support research and policies that advance Native American languages, even though instruction in those languages improves student outcome. My amendment would require the Institute of Education Services to, in consultation with tribes, increase research on Native American languages, coordinate with and support the Native American Language Resource Centers, and expand regional technical assistance for programs that support Native American languages. I urge the chair, ranking member, and my colleagues to work with me to advancing this effort and look forward to strengthening efforts to protect Native American languages. Thank you, Mr. Chairman. I withdraw my amendment.
Thank you, Senator Lujan. Further amendments? All right. Now we'll move on to S3393. And this is, of course, the Support for Patients and Communities Reauthorization Act, and we will have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it be considered original text for the purpose of further amendment. All those in favor, please say aye. Aye. All those opposed, no. The ayes have it. The motion is agreed to. Are there any members who wish to speak on or offer an amendment to S 3393?
Mr. Chairman,
Yes,
over here.
there you are. I knew you were there.
I'm going to be quick on it. I've got two asking for a vote, one to talk about and withdraw, and I'll do it quickly. Can I go through all three of them?
Yep.
Thank you. Amendment number one, our country it's called the Freed of Opioids Act. The country is awash in opioids, both legal and illegal. In touring Indiana, I hear from Hoosiers and law enforcement that more needs to be done to stop the opioid crisis. My bipartisan amendment would require the FDA to review a flawed clinical methodology that skews results for opioid drugs towards approval. I recognize the importance of retaining a variety of opioid painkillers on the market for those with chronic pain. This amendment does not remove any drugs from the market, but we must also ensure that the mistakes of the past do not continue unchecked into the future. Americans should have transparency for what goes into the approval of their drugs. And I ask for a roll call vote on it.
Discussion on Braun number one.
I'll go.
Senator Cassidy?
I appreciate the intent behind this, but I will oppose. The policy is duplicative of measures already included in the manager's amendment and of work that has already occurred at the Food and Drug Administration. So again, appreciating the intent, but feeling as if it's already been addressed.
Let me say a word on it. I thank Senator Braun for his amendment. This amendment would require FDA to convene an advisory meeting of outside experts to review the use of a controversial methodology used in clinical trials for opioids. Is that it? Senator Braun, is that about what it does?
Yes.
Okay. Now, according to at least one organization, the Opioid Policy Research Collaborative, quote, the FDA has been putting new painkillers on the market based on improper studies that skew results in favor of approval. The methodology they're using was cooked up in private meetings with drug makers. The time for outside experts to examine this issue is long overdue, end of quote. This amendment builds on the Support Act, which requires the FDA to study this controversial methodology and come up with a plan to review all approved opioid drugs, and I would urge a yes vote on the amendment. Further discussion?
Mr. Chairman?
Senator Casey.
Mr. Chairman, I wanted to speak on Casey number one, which will...
Okay, we stay on Braun number one. Let me see if we're any more on that. Braun one?
I just would offer that I support Braun 1 for the reasons that you've just stated. The methodology that these companies were allowed to use is deeply, deeply flawed and really fueled this epidemic.
Further discussion on Braun 1? All right, not hearing any. Senator Casey?
Thanks very much. I wanted to speak on Casey number one, which I...
Oh, I'm sorry. I promised Senator Braun that he would go.
I'll be quick.
Go ahead.
Okay.
Braun Amendment number two, the Effective Act. Last year, FDA Commissioner Califf told me that the FDA lacks the authority to deny a new opioid on the basis that the new drug is not better or safer than other comparable drugs. Opioids are a unique drug class. They are essential in treating pain, but they are also some of the most dangerous drugs available. I offer this amendment with Senator Baldwin to give FDA the authority that Dr. Califf requested. My amendment would not remove any currently available drugs from the market. When it comes to a class of drugs that has killed hundreds of thousands of Americans, FDA should have more discretion to ensure safety.
Discussion of Braun 2.
Again,
Cassidy?
I thank Senator Braun for, my gosh, we should all be focused on this. Thank you for being so. I support this amendment. It's a little bit different. This is a different standard, and I discussed this with my staff. We don't normally require this same, this would be an elevated requirement for a new opioid. But as I told my staff, when it comes to opioids, we have to treat them differently. When so many people are dying, it would be, naive to treat it the same way as we would treat a new statin. So I thank you for your willingness to think creatively, and I support this.
Further discussion? I also support this amendment, which would allow FDA to consider whether new opioids are safer or more effective than existing opioids when determining their approval. I think it makes sense. Further discussion of Braun 2. Senator Braun.
Final amendment number 3, Healthcare Transparency Price Act, is arguably the most important thing I think we need to discuss. I'm going to talk about it and withdraw it. I can tell you, when I tackled this same issue in my own company 15 years ago, until you get your own employees, all of us engaged as healthcare consumers, don't count on costs going down either from a government payer or through the private insurance system. When you go to the hospital, there's very little transparency on prices, leaving everyone guessing how much is it going to be when you get your bill 3 months later in the mail. There's also a lack of transparency regarding the agreements. Probably the biggest level of opaqueness in anything we do in our healthcare system between big hospitals and insurance companies. Recently, we've seen examples where huge employers have found serious disparities and wasteful practices in their own plans, and they can't get to the bottom of it. My amendment would require hospitals to publish detailed files of all negotiated rates and cash prices between plans and providers, not estimates. It also codifies the transparency in coverage rule. And the bill provides group health plans the right to access, audit, and review claims and counter data. I'll be withdrawing this amendment, as I said, but until we embrace something like this across the totality of healthcare, we're never going to lower costs. Thank you, Mr. Chairman.
A clarification, Senator Braun, you're withdrawing the third amendment. Do you want votes on 1 and 2?
Yes, I do.
Both of those?
Yes.
Okay. All right, further discussion on 3393.
Mr. Chair.
Senator Kane.
Kane Amendment 1, I'd like to call up, and I want to start by thanking both Chair Sanders and Ranking Member Cassidy for including a portion of my bipartisan Peer Support Act in today's markup. And I want to thank members of this committee, Senators Murkowski and Braun and Baldwin, for supporting the amendment that I'm calling up. The goal of the bill is to provide support for the treatment of and recovery of individuals experiencing mental illness and substance use disorders. The provision that's included in today's markup I don't need to speak about, but what this amendment does is includes provisions of something, the Peer Support Act. It would include a provision to instruct the Department of Health and Human Services to conduct a study on states' screening processes for certifying peer support specialists, including provisions that may provide undue barriers to their certification. I bet most of you have had these discussions in your communities as you've gone and talked to folks who are working with those who are trying to recover from substance use disorder. And often what they tell you is, boy, the best help I got was from a peer support specialist who him or herself had a substance use disorder, has recovered, and now they are a great counselor and guide along the way to recovery. But a lot of states have barrier crime provisions that block the certification of individuals to become peer recovery specialists if they've been convicted of drug-related crimes. This doesn't mandate that states do anything, but it enables us to study the different state practices for allowing people who are successfully recovered to be peer recovery specialists, even if in the past they might have had some involvement with the criminal justice system. So that's what this provision would do, just study the different state practices and hopefully bring forward some best practices that we can use going forward to make sure that we have the peer recovery specialists who are good at what they do. And I thank my colleagues for helping me with this.
Further discussion on Kane 1.
Comment.
Chairman, Mr. Chairman, just a question for Senator Kane, which is, we've received some feedback on this amendment that there's some concern that there could be people that would misuse this relationship. Someone, is looking for being able to become a distributor of harmful narcotics and so forth, and would get to meet all of these people. And when this person that was formerly hooked perhaps falls back into that difficulty, they know some other people, they're able to sell to, and that basically having someone who'd been an addict meeting with other people trying to recover from addicts would create a situation where you'd be encouraging more addiction. So I'm curious as to what your thought is on that and how you deal with that issue.
certainly, that's a fair concern. So this does not mandate that states do anything, and it would allow a study by HHS to explore what different states are doing. Has it worked? Have they had problems of the kind you described? If they've had those problems, how have they modified the program to allow the peer recovery specialists, but guard against any of those or other problems? So it's sort of the gathering of what states have done on this to try to come up with the best practices so that we can take advantage of the recovered who want to be agents of others' recovery and their desire to do that. But it would not mandate, anything that would sort of run afoul of the concern that you raise.
Further discussion, Senator Cassidy?
It does, however, tell HHS to make recommendations, and I'm not just sure that HHS is the appropriate agency to be making recommendations regarding background checks. I will oppose, not because I like the spirit of it, but it does seem as if HHS, which has got a difficult time already accomplishing those things to which it should be addressing, to give it something else which probably it shouldn't be. Again, I'm skeptical of their overall ability and where this will go.
Further discussion?
Mr. Chair, just on Senator Kane's amendment here, I just met with leaders in my community yesterday, mental health and addiction health providers. Among other things they talked to me about was the critical importance of improving the access to peer services, that it is by far the most effective part of the wraparound services that people who are trying to recover from addiction need. And so I would really ask us to think about that priority. Again, it's not requiring any state to do this, but what I am hearing on the ground, New Hampshire's been ground zero here for a long time, as has some of the other states here, is that this is incredibly important. And I would just ask us to consider what we're hearing from our grassroots leaders in this. Thanks.
Further discussion? Okay. I support the amendment. It takes a serious look at our current criminal background check programs for individuals who could play an active role in peer support. Senator Casey, did you want to?
Yeah, Mr. Chairman, thank you very much. I wanted to speak on my amendment that I'll ask for a vote on. It would add and it's KC1, it would add the Advancing Research for Chronic Pain Act to the legislation. As we work to prevent substance use disorders, it's important to consider the substantial impact of chronic pain throughout the country. We're told that 1 in 5 adults are living with chronic pain. Many have pain that significantly impact their ability to work. We're told that 50 million Americans live in pain either daily or nearly every day. Chronic pain stems from many underlying conditions and sources. Those suffering include people with pain from conditions like, of course, cancer, sickle cell disease, multiple sclerosis, and other chronic diseases. Beyond the significant emotional toll of the pain, it's very costly. In 2011 report from the Institute of Medicine, now that we refer to as the National Academy of Medicine, estimated that between healthcare costs and lost productivity, just those two categories, the annual cost of chronic pain was up to $635 billion. And of course, that estimate was in 2010 dollars. Despite the massive social and economic costs of chronic pain, we lack large-scale data that's needed to fully understand and develop better approaches. Senator Kane and I have filed an amendment to address this. In September, Senator Blackburn and Senator Kramer, with Senator Kramer and Senator Blackburn, we introduced the Advancing Research for Chronic Pain Act, a bill that would improve data collection on chronic pain and create a centralized chronic pain information hub to aggregate the data and actionable information for clinicians and scientists. The bill would help move chronic pain research forward so we can better serve more than the 50 million that I mentioned. We cannot afford to neglect this important issue. I thank my colleagues for working with me to bring forward a bipartisan proposal to respond to the needs of people experiencing chronic pain. With that, Chairman Sanders, Ranking Member Cassidy, I ask for a vote on the amendment and would like to comment. I'll comment later on other aspects of the hearing.
Further discussion on KC1? In my view, we need better data on who is experiencing chronic pain, what services are being provided, and whether our treatment options are effective. I support the amendment. Senator Cassidy?
I appreciate Senator Casey's goal of better understanding and addressing chronic pain as a means to prevent opioid dependence. I'm told that HHS is already doing this. The amendment, though, would create a new program which we've not had a chance to consider. For example, what is HHS already doing? We've got government bureaucrats stumbling all over themselves. And so before we know actually if we're already doing this and the degree to which we are and current effort, I will oppose, but look forward to learning that at a future hearing, and hopefully if it's not duplication, support, and if it is duplication, we just need to focus our dollars where it should be used.
Further discussion on Casey one? Okay, I think we have,
Mr. Chairman?
yes,
Go ahead, ladies.
Oh,
Go ahead.
yes.
do you have something too?
Senator Hassan.
So I want to thank you, Mr. Chair and Ranking Member Cassidy, for holding this markup. The fentanyl crisis continues to devastate communities in my state and across the country, and as the leaders I referenced just a couple of minutes ago reinforced to me yesterday, getting a handle on this and helping people recover, helping the country recover, is going to take sustained and predictable resources. Addressing this crisis continues to require an all-hands-on-deck approach, and we have to use every tool that we have. The Bipartisan Support Act played a large role in creating the fundamental infrastructure that we need for addiction prevention, treatment, and recovery in our communities. With today's reauthorization and expansion of the Support Act, we will invest in essential resources to help prevent overdoses, treat addiction, and help people stay in recovery. So I thank you for working to reauthorize this critical legislation. I would like to offer an amendment and request a vote on it. It is Hassan-Mullen Amendment number 1. This amendment would reduce the risk that dangerous prescription medications could fall into the wrong hands by expanding the scope of current electronic prescribing rules for controlled substances. Thanks to the Support Act, under Medicare, prescription drug plans controlled substances prescribed under Medicare have to be prescribed electronically. My bill with Senator Mullen would expand this best practice into commercial insurance. As of this year, nearly all pharmacies and over 80% of prescribers in the U.S. already have a system in place to meet these requirements. This is a common sense way to reduce the risk of prescription drug misuse and fraud, and would save anywhere from $100 to $250 million over 10 years. So I urge my colleagues to support this amendment, and I'll ask for a vote at the appropriate time. Thank you.
Discussion on Hassan-Mullen 1. Senator Cassidy.
I appreciate Senators Hassan and Mullen for their work on the amendment. And Maggie and I talked about this. And also, one of those things that I began to hear about, and then I heard from providers, and this does give commercial insurance more power over individual physicians. And there's a real reluctance of that because, frankly, there's no trust of the insurance companies by the individual physicians. They feel sometimes that they're whipsawed and they're not quite sure that the motivations of the insurance company are entirely pure. So I say that because maybe it's wrong, but it's one of those things that just seems as if it should be explored further before we do something which is fairly significant. So for that reason, I shall oppose.
Further discussion? Senator Mullen.
Thank you, Senator Hudson, for bringing this up with me and Senator Cassidy. This is something I've been working on for years over at Energy and Commerce on the House side. What this basically does is it helps prevent the physician's pads from being stolen. It prevents the addict from shopping different pharmacists, knowing which ones will do electronic verification and which ones don't. This is a huge issue in rural Oklahoma, especially where I'm from. And there is some independent pharmacists that at first resisted it. But now all of them provide Medicare and Medicaid prescriptions, and they're used to doing it already. This is just one step of helping verify and take away the criminal aspect of it. And I mean, our health records are already electronic. They can already pull this up. So, and like I said, this isn't something that I need to go any farther with. This is something that I've literally worked on for years. And originally I tried to do it with independent providers too, and they resist it for the same excuse, what you're saying, what they gave you too. And that's why we went with Medicaid and Medicare. And there has been no flaw with it. It actually has been, it actually has been well received because it takes away also the liability from the pharmacists themselves for not doing their due diligence on checking on this individual to begin with. Because technically, if they have any concerns whatsoever, they're supposed to call the physician. The problem is the physician isn't open at midnight or at 7 o'clock or at 6 o'clock, or they're just not available at the time and the nurse isn't available. And this lets the pharmacist know, yes, this prescription was written by this doctor at this time and was prescribed to this patient for this amount of pills.
And thank you, Senator Mullen, for all your work on this issue. Thank you for joining me in this effort. And thank you, Senator Cassidy, for raising the concerns you raised. The vast majority of prescribers are equipped to meet the requirements in this amendment, as Senator Mullen just laid out, because they're already doing it for Medicare. My team also received feedback from providers, and we work to minimize the potential burden on prescribers. For example, under this amendment, the Secretary will issue specific rules for plans to direct how they carry out this requirement. Insurance plans will have to use the exact same standards that doctors already comply with under Medicare. And in this amendment, we also protect doctors who need an exception due to certain circumstances. We do this by directing commercial insurers to recognize the exceptions that providers have already obtained under Medicare. Electronic prescribing for controlled substances is widespread, and we must finish expanding this practice to keep dangerous drugs from being diverted. So I appreciate the concerns you've raised, Bill. I appreciate Senator Mullen's leadership and work on this. I do think this is the right thing to do. Thanks.
Further discussion on Hassan Mullen? Electronic prescribing of controlled substances can increase efficiency and safety in the health system, improve patient care, and according to the CBO, will likely save money. And I support this amendment. Okay,
Mr.
other
Chairman?
amendments? Yeah.
Oh,
Where we
Go ahead.
Yeah, Senator Smith.
Thank you, Chair. So I'm offering and withdrawing Smith Amendment Number 1, the Mental Health Professionals Workforce Loan Repayment Act, which I've worked on with Senator Murkowski. So today we're marking up the Support Act, which I strongly support, but I think we all know that substance use and mental health are often deeply intertwined. People with substance use disorder may have mental health disorders, and people with mental health disorders also struggle with substance use. So the treatment is also intertwined, and that's why this is relevant today. I think we can all agree that everyone should have access to the quality mental health care, regardless of where they live, what their insurance is. But right now, there is a severe shortage of mental health professionals. We've talked about this a lot in this committee. So what our amendment would do would be to provide loan repayment for mental health providers that are working in shortage areas. It would help to attract mental health professionals that are working on the front lines with the mental health crisis, and it would help us to address the barriers that stand in the way of every American accessing the quality mental health that they need. So, as I said, I am withdrawing this amendment, but I would ask for the chair and the ranking member to work with me on this as we take up mental health in this committee in the coming year.
Absolutely. Okay, further amendments?
Mr. Chairman?
Yes, Senator Marshall.
Mr. Chairman, I want to call up Marshall Amendment Number 2 regarding FDA guidance, which we believe will promote the development of non-opioid alternatives for acute and chronic pain management. Leading this amendment was Senator Markey. I appreciate his efforts and support as well, and this is modeled after legislation that Senators Shelley Moore Capito and Marsha Blackburn have worked on as well. When I think about the situation now with the lack of new alternatives, non-narcotic alternatives to pain management, I went back and did some history research. Acetaminophen, Tylenol, was discovered in the 1870s. Ibuprofen, which we now would call Advil or Aleve, discovered in the 1960s. Toradol was a new miracle drug that was approved by the FDA in 1989, but has limited use because of its side effects. And in my clinical history, I can't think of anything else significant, any miracle pain medicines that are still on the market that have come since 1989. Vioxx was taken off the market, some of those types of drugs as well. We've seen no improvement now in, goodness, 50 years on non-opioid management of pain. So our legislation tries to address that. The pharmacological industry relies on the FDA to provide rules of the road to get approval for various therapy classes, whether it's Alzheimer's, COVID vaccines. We need that same type of guidance when it comes to these non-narcotics. They're called guidance documents. So based on these documents, innovators and their investors decide how to proceed or not at all. Drug development, as I pointed out, has been extremely difficult for innovative pain medicine. According to the industry report, there's only a 2% probability of an FDA approval from phase 1 compared to the 10% success rate of all other disease medicines. The 2018 Support Act required the FDA to foster the development of novel analgesic drugs by assisting sponsors with the development of non-opioid alternatives for acute and chronic pain management. Unfortunately, the FDA has not fulfilled this requirement. It's only produced draft guidance for acute pain, so that stymies the research. Our amendment holds the FDA accountable. That's our job. Our job is to hold the FDA accountable. It reinforces the requirement to publish guidance for non-addictive drugs that treat chronic pain. This is the greatest opportunity to avoid long-term opioid use and risk of addiction, especially for the 16 million Americans with chronic lower back pain who worry about overusing opioids. These patients don't want to use the opioids, but they don't have any other good alternative out there. I believe that American ingenuity will one day make opioids a thing of the past. We can help pave a brighter future by encouraging the pharmaceutical industry to continue taking risk. We hope you'll support our amendment. Thank you.
Mr. Chairman.
Senator Markey.
Thank you, Mr. Chairman. First, I would like to begin by thanking Senator Marshall for his work on this very important amendment. There is a clear cause for the opioid crisis. Pharmaceutical companies lied about the addictive nature of OxyContin. They lined their pockets while fueling an epidemic that has cost 250,000 lives in the United States to the prescription drug overdose aspect of this crisis alone. But there are still patients living with chronic pain that must be treated without exposing them to unnecessary risk of misuse, dependence, and overdose. And as we work on supporting patients with substance and opioid use disorders, we have to ensure that patients with chronic pain are adequately treated for their pain. 5 years ago, the Food and Drug Administration was tasked with supporting the development of non-addictive pain medication for acute and chronic pain. That work has not yet been completed. That is why I've joined with Senator Marshall in introducing this amendment to reassert Congress's intent that the Food and Drug Administration issue guidance to support the development of non-addictive pain medication for patients with chronic pain. This is key to bringing alternatives to addictive pain medication to the table. We can't wait another 5 years. We can't wait another 50 years for breakthroughs in this area. So thank you, Senator Marshall, for your leadership on this issue, and I would ask for support for this amendment.
Senator Casey? Senator, did you want to? Senator Lujan, did you want to?
Mr. Chairman, while I support this amendment, I was asking to be recognized to offer an amendment.
Okay, let me, Senator Cassidy.
Thank you, Marshall and Markey, for your work on the amendment. It ensures the FDA does all it can to support the amendment of novel non-opioid pain drugs. I shall be voting yes.
Further discussion? In my view, it is clear that we need to support the development of alternatives to opioids. As we all know, opioids are highly addictive and have destroyed too many lives in this country, so I applaud the work of Senators Marshall and Markey. Support the amendment. Further discussion on this amendment? Don't see any. Senator Lujan?
Thank you, Mr. Chairman. I will offer and withdraw this amendment. However, I want to stress that this is a common sense provision that will save lives. I want to thank Senator Murkowski for her partnership on this amendment, as well as Senator Durbin and Senator Capito for their leadership on this bill. This bipartisan amendment would amend an existing program included in the 2018 Support Act that supports hospital-based programs efforts to prevent an overdose patient from overdosing again. We know that the cycle of trauma and addiction means that a patient is at acute risk in the days after they leave the hospital of overdosing again. So rather than just stabilizing them and send them back out, this program would support hospital efforts to provide trauma-informed mental health services case management, and other assistance to prevent the likelihood of their readmission. The policy recognizes that the cycle of addiction, suicide, and violence are all interrelated and allows hospitals to deliver these same types of trauma recovery services to more patients. There are programs in New Mexico that are working to do just this, and I know there are similar programs operating at the University of Kansas, in Indianapolis, and in Maine, and at the University of Utah's hospital. This amendment is supported by the American Hospital Association, National Head Start Association, Prevent Child Abuse America, Futures Without Violence, Social Current, and the American Academy of Pediatrics, and many more. If we want to break the cycle of addiction and mental health challenges, delivering services in the hospital and upon discharge is a golden opportunity to prevent more harm. I hope we can find a way to advance this issue before the Senate completes its consideration of this package. Thank you, Mr. Chairman, and I withdraw the amendment.
Thank you, Senator Lujan.
Mr. Chairman,
Senator Murkowski.
I just want to comment, following Senator Lujan here. I really appreciate your leadership on this. This is something that Senator Durbin, Senator Capito have been working on with their Rise from Trauma. I've been able to support that for several Congresses now, and I know that others have as well. And I think we recognize that there is so much that goes into overdose, addiction, suicide, violence, all of this interrelated trauma that an individual experiences, and what more we can do when we think about coordinated care, including trauma recovery services to help those, to help them heal, help them prevent readmissions. So know that I look forward to working with you. I think we're starting to make some good headway, but we need to do more. Thank you, Mr. Chairman.
Thank you. Further discussion on S3393. Senator Cassidy.
I'm going to offer and withdraw this, but my amendment would allow for-profit providers to receive grant funding from the Community Health, Mental Health Services Block Grant. We've got to give states flexibility. In some places, the only entity providing mental health services are those which are for-profit. We've spoken of the shortage of mental health providers, and of course, there's not a shortage in the downtown of most metropolitan areas. There's a shortage in the rural areas. Under my amendment, states could choose to make for-profit providers eligible grant recipients, and they could also choose to provide these block grant dollars to nonprofits. States should be in the driver's seat to choose what is best. It would help fill in the gap in rural communities where there's just not enough nonprofits to meet the current demand. I'll continue working on the priority. It's a priority. The chair is opposed, and so I'm not going to seek a vote, but I do hope to get this done. We need to be creative as we provide mental health services in those areas which are mental health deserts.
And you withdraw the amendment, is that correct?
Yes.
Okay. Further amendments? Yeah, Senator Tuberville.
Mr. Chairman, I'd like to call up Tuberville Amendment Number 1 for consideration. I'd like to take this opportunity to discuss an issue that I believe is directly related to everything we've talked about in here. I believe it's impossible to discuss our nation's opioid epidemic without discussing the crisis at the southern border. You know, back in March, I introduced the Border Safety and Security Act. This legislation requires the Secretary of Homeland Security to suspend the entry of illegal immigrants into the United States until we have control of our border again, because we've lost it. 6.5 million illegal immigrants have been apprehended by the Customs Border Patrol protection since January 2021. In fiscal year 2023 alone, CBP seized 1,000 pounds of fentanyl at the border. Imagine how much fentanyl made it into the U.S. without being caught by law enforcement. Imagine how many lives we've lost. Over 100,000 a year in this country. 8 to 10 in my state a day in Alabama, not counting the cost of health care. Mental illness, I keep hearing about people training new mental health professionals, and that's great. If we don't stop this drug coming across the border, we're not going to fix anything. We're wasting our time. I'm offering this bill as an amendment to support ACT today because I think we must take a good hard look at this. We've got to do it. Finding ways to address substance use disorders is worthwhile and should be seriously considered by this committee. But unless we do something to address the supply addiction, will only continue and get worse. We will never get out of this epidemic without it. So every day we leave it open, it's becoming the biggest disaster of our lifetime. And we're in there talking about mental health people working. It is a disaster. I taught for 40 years, and I've never seen the influx of what's happening, not just in our communities, but our schools. We wonder why we have problems. It's an absolute disgrace. Therefore, I'd like to offer and withdraw this amendment, Mr. Chairman. Thank you.
Well, Senator Tubble, of course, you raise a very important issue, but you know that that is outside the jurisdiction of this committee, and I appreciate you withdrawing it. Further amendments, Senator Senator Murkowski, then we'll go to Senator Markey.
Thank you, Mr. Chairman. Those of us from rural areas talk about telehealth a lot and the benefits of telehealth. I have an amendment that I will offer and withdraw. This is the telehealth response for e-prescribing addiction therapy services. Again, access is so challenging for so many, and I remain concerned that we have many Americans who really will be left behind as we're trying to tackle the opioid epidemic if we limit our opportunities to telehealth. The TREATS Act makes the critical services of addiction treatment accessible by telehealth, extending the flexibilities that were provided under the public health emergency from COVID-19. They make permanent audio-only and audio-visual prescribing of controlled substances under Schedules 3-5 for medications for opioid use disorders. It was interesting. I had the Secretary of Health and Social Services up in Alaska a couple years ago. This was during COVID, and the recognition that what many of our providers were looking for was we put in place these provisions, these emergency provisions through COVID to be able to access by Zoom, but not by telephone. And in so many of your rural communities, despite what we're doing to get capacity, broadband telecommunication capacity all over, you still have areas where the only way you can do it is talk to one another. So how we ensure that, again, when we think about just the scourge of addiction and opioids and all that we're seeing with fentanyl, that we're not leaving our rural communities behind. So I'm withdrawing this morning in the hopes that colleagues will continue to work with us on this particular initiative. I am pleased that we're moving forward with the Support Act. There's so many important provisions that we are including today. I'm pleased that we've been able to advance the Substance Use Disorder Treatment and Recovery Loan Payment Program. Senator Smith talked about her continued work on that, and I want to commit to doing that with you. We've got good progress under the FASD RESPECT Act, the Fetal Alcohol Spectrum Disorders. I've been working on this with Senator Klobuchar. We've included provisions of Bruce's Law, which for us on the fentanyl issue is so important in terms of what more we need to be doing for prevention, education, and awareness. This was named after a young Alaskan who was poisoned by fentanyl just 2 years ago. The Preventing ACEs Act, again, that has been so important, and Senator Kane, your work with the Peer-to-Peer Mental Health Act included is so important. So I think we're getting in a good place with the Support Act, and I'd like us to make sure that we don't stand down on some of the telehealth provisions. Thank you, Mr. Chairman.
All right. Telehealth has been a lifeline to those in need of substance use services, especially among those living in rural communities who might not live near life-saving treatment and services. I support this amendment. Okay, other amendments. Senator Markey.
Thank you. Thank you, Mr. Chairman, very much. And I just want to add thank you, Senator Murkowski, on this issue. In 1994, when I was the Democratic author of the law to move us from analog to digital, I had a hearing that had a Mass General doctor with an Iowa rural doctor talking about if we could move to HD, if we could move to digital, then there could be ongoing consults. And unfortunately, our laws have not caught up with ensuring that there is proper funding, proper insurance coverage, proper recognition of the role that that technology can play. But it's not a new issue. That was the subject of the discussion, why we should move to analog to digital in the United States in the first place, so that this telehealth for all purposes can be provided. I'm very grateful to you, Mr. Chairman, for all the work which you are doing on the substance use disorder treatment access, but there is more that needs to be done. And what Senator Murkowski is talking about is one of those issues, because we have to deal with the factors driving our behavioral health crisis. According to data from the Department of Housing and Urban Development, about 1 in 6 people experiencing homelessness has a substance use disorder. Behavioral health conditions, including substance use, can be both a cause and a consequence of homelessness. It's hard to stay in recovery without housing, and it is hard to get housing when you're struggling to maintain sobriety. Response to both crises need to be responses to those who are struggling with both simultaneously. And that is why I've offered this amendment today based on the legislation that Senator Padilla and I have introduced, Homelessness and Behavioral Health Care Coordination Act, to help those experiencing both homelessness and substance use disorder access services. It would authorize a grant program to better coordinate these services and to help us better serve those in need. Healthcare is a human right. Housing is a human right. And it is here where we see their intersection, where there is not enough attention which is being paid to these dual rights, in fact, becoming a reality for a high percentage of our homeless population. We just have to make it easier for people to get the services which they need by knocking down the silos that keep people from stable housing and the health care which they need. I'm going to withdraw the amendment, but I do think it's very important for us to talk about this issue, because we can't get at the root cause if we don't understand and deal with how they intersect. So at this point, I just ask unanimous consent to withdraw the amendment, Mr. Chairman.
Okay, I think, Senator Marshall?
Yes, Mr. Chairman, one more. I'd like to call up Marshall Amendment number 1 regarding prior authorization and prescription drugs. We're going to offer and withdraw this amendment as well. This would add a section to the reauthorization of the Support Act. The original Support Act required Medicare Part D plans to provide an electronic prior authorization process for physicians, nurses, and other healthcare providers. The need for the legislation then was clear. There were challenges of fraud, misuse, and abuse. The prior authorization process was antiquated and inconsistent, and as a result, it delayed in timely access to evidence-based medicine and added inefficient and mind-numbing administration hurdles for clinicians and support staff, and thus delaying the needed care of patients. Congress aligned electronic prior authorization standards to better secure the electronic transmittal of prior auth requests for prescription drugs covered under the Medicare Part D. This regulation was finalized last year. Our amendment would take this another step forward by applying this provision to the commercial market. The need for this amendment is just as clear now as it was then, when we overwhelmingly decided to establish it in Part D. According to the Department of Labor, mental health parity and equity laws are not being adhered to. This means that patients who need medicines for substance use disorder or mental health have more prior authorization hurdles than patients getting physical medicine. Over and over in my conversation with different groups of physicians, none more than my psychiatrists, my psychologists, my certified counselors are having problems getting their patients access to these medicines that include the likes of buprenorphine, methadone, and naltrexone. Clinical burnout rates and shortages are getting worse. We have an opportunity here today to build on things that work in our amendment, which is pro-patient, pro-provider, and pro-health plan. We're basically codifying what plans are already doing, at least the good plans are doing. But we're going to withdraw this amendment based on the commitment already by the chairman and ranking member to fine-tune the text and confirm a negligible CBO score. Thank you so much, Chairman and ranking member, for your support. And again, we're withdrawing the amendment.
Thank you very much, Senator Marshall. We have one more bill to go over, and then we can get to roll call votes.
Mr. Chairman, while that amendment was withdrawn, I'd like to ask unanimous consent to be added as a co-sponsor.
Okay. We'll now consider S-644, Modernizing Opioid Treatment Access Act, and we have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it be considered original text for the purpose of further amendments. All those in favor, please say aye. Aye. All those opposed, please say no. The ayes have it, and the motion is agreed to. Are there any members who wish to speak on or offer an amendment to S-644?
Mr. Chairman, I have an amendment. Rather than take your time, I'll withdraw it.
That was a brilliant amendment. Yes, further, Senator Markey.
Yeah, thank you. Thank you, Mr. Chairman, very much. And I want to thank Senator Paul as well for partnering with me on the Modernizing Opioid Treatment Access Act. And I want to thank you, Mr. Chairman, and Senators Braun, Hassan, Lujan, and Casey for co-sponsoring this life-saving legislation. I'm especially grateful to the many people in recovery and living with opioid use disorder, their families and their friends, the people who have lost loved ones to overdose and healthcare providers, including many practicing in opioid treatment programs, for their support of the Modernizing Opioid Treatment Access Act. Methadone is a medication that works to treat opioid use disorder. Under current law, the only place that someone can get methadone to treat opioid use disorder is an opioid treatment program, also called a methadone clinic. Some patients have to go to an opioid treatment program every day or week to get their medication. But opioid treatment programs can be hard to get to. More than 85% of people are forced to drive more than 30 minutes to a clinic, which can have limited hours to begin with. And when neighbors or colleagues or friends can see you walking into a clinic to get a dose of methadone every single day, it can be incredibly stigmatizing. Accessing methadone reflects a 50-year-old system that was set up before we had good guardrails or even better science to understand that the status of creating a whole separate system to deliver a medication isn't working for everyone. It does not work for the thousands of people in the United States who would stay in recovery with methadone medication treatment if not for our antiquated, stigmatizing system that is built into federal law. These are the stories of Americans who are struggling every day to access methadone and keep their job and take care of their family and live their lives just like everyone else around them. But the status quo definitely does work for the companies investing in opioid treatment programs, hoping to protect their bottom line over the lives of the patients they are meant to serve. For these investors and companies, methadone access is motivated by profit and not by people. This is why we need the Modernizing Opioid Treatment Access Act. This legislation would allow the most highly trained addiction doctors in the country who register with the Drug Enforcement Administration to prescribe methadone to patients to pick up at a pharmacy. The amount of medication doses that a patient can take home would fall under the same regulations that opioid treatment programs have to follow. As the Congressional Budget Office noted in their analysis of the bill, this legislation will save lives by increasing access to treatment. And in the era of fentanyl with opioids like nitazines that are far more potent, starting to spread into communities, and next year we won't be talking about fentanyl, we will be talking about nitazines. That's what we're going to talk about next year. That's the legislation that we will be working on. We've moved from technology to technology as it's been developed, and these new, even more potent drugs are starting to spread into communities. And the most dangerous thing we could do is to keep medication that works to prevent diversion and overdose locked behind outdated laws.
Okay. Thank you,
I urge
Senator.
my colleagues to vote yes to the Modernizing Opioid Treatment Access Act because it is a vote in order to give the treatment to people who need it. And just to give you an example, the Oxy issue 1.2 million doctors could in fact prescribe oxy. This amendment allows 7,000 doctors, but those are the ones that have received their training in addiction, who are physicians who know how to do it. So it's a very narrow area, but methadone access is absolutely critical, and I urge my colleagues to support it.
Okay. Senator Cassidy?
You know, I've been hearing from a lot of folks about this one. Law enforcement, of course, is concerned about diversion. Some physicians who feel like the wraparound services through the clinics is essential. And then there is, as you mentioned, Senator Markey, the American Association of Addiction Medicine, which supports. And I've been looking at the medical literature, and including an article that was sent to me this morning. The best evidence I can see is that it has not resulted in diversion. And there is an increased mandatory spending, which I have opposed if it's just to circumvent what our appropriators are doing. But in this case, the increased mandatory spending is because more people survive and therefore consume more services. Now, as a rule, as a doctor, I don't mind people surviving. I think survival is a good thing by and large. So I'm going to go ahead and support this, knowing that people will vote their conscience. But the medical evidence I saw, no excess diversion, but increased saved lives.
Yeah, thank you so much.
Okay, I believe, Senator Marshall?
Mr. Chairman, I missed an amendment to the Education Bill S3392. If I could go back and submit Marshall Amendment 1 now.
Okay.
Okay, so this is Marshall.
1 minute, make it brief.
Marshall Amendment number 1 was to provide no funds may be provided in an entity that receives funds from a covered nation. Across the nation, we've seen foreign influence seep into our schools, from Confucius Institutes to Little Red classrooms. We cannot allow our enemies to infiltrate the classroom like this and spread anti-American ideology. It's been reported that the Chinese Communist Party has directly funneled millions towards these programs in schools, affecting 170,000 students across 143 school districts. This amendment will keep schools accountable for the entities they deal with by prohibiting funds from this bill going towards schools receiving funding from covered nations. The definition of a covered nation comes from Title 10 of the U.S. Code and is a narrowly defined list that includes only North Korea, China, Russia, and Iran. I hope our colleagues here will join me in supporting this amendment and protect our students from the influence of our greatest enemies. Thank you. I yield back.
Let me just respond to Senator Marshall's amendment, and I am concerned that the scope of this amendment is overly broad and could prohibit some of our top institutions from participating in critical educational research partnerships due to ongoing exchange programs or cross-national research, so I will oppose it. All right, I think we are ready to vote. Fair enough?
Mr. Chairman, could I just ask unanimous consent that Senator Paul's statement be included
Without
in the record
objection.
in the methadone
without
access
objection.
bill? Thank you.
All right, note the presence of a quorum, and we'll now move to votes. We'll now be voting on final passage of S 1840 as amended. I move to favorably report S 1840 as amended. The clerk will call the roll.
Senator Murray? Aye. Senator Casey? Aye. Senator Baldwin?
Aye by proxy.
Senator Murphy?
Aye by proxy.
Senator Kane? Aye. Senator Hassan? Aye. Senator Smith? Aye. Senator Lujan? Senator Hickenlooper?
Aye.
Senator Markey?
Aye.
Senator Cassidy?
Aye.
Senator Paul?
Not voting.
Senator Collins?
Aye.
Senator Murkowski?
Aye.
Senator Braun?
Aye.
Senator Marshall? Senator Romney? Senator Tuberville?
By proxy, aye. By the way, that was by proxy, aye for Braun. I'm sorry. But Tuberville by proxy, aye.
Senator Mullen?
By proxy, aye.
Senator Budd?
By proxy, aye.
Chairman Sanders?
Aye.
I have 20 ayes, 0 nays.
The ayes have it. The bill is agreed to and will be favorably reported as amendment. We'll now move to... Yes, you may, because you are in person. We'll now move to amendments to S 3392. We'll now vote on Marshall Amendment Number 2, S 3392. Senator, would you still like a vote on that, or? Okay.
We're going to work going forward on changing the word allows to promotes. Perhaps we can get that accomplished between here and when this reaches the floor.
All right, but the word allows is what is in there right now.
Yes, sir.
Okay. Okay, a vote on Marshall Amendment Number 2.
Senator Murray? No. Senator Casey? Aye. Senator Baldwin? Aye. Senator Murphy?
No by proxy?
Senator Kane? No. Senator Hassan? Aye. Senator Smith? No. Senator Lujan? No. Senator Hickenlooper? Aye. Senator Markey? No. Senator Cassidy?
Aye.
Senator Paul?
Not voting.
Senator Collins?
Aye.
Senator Murkowski?
Aye.
Senator Braun?
By proxy, aye.
Senator Marshall? Aye. Senator Romney? Aye. Senator Tuberville?
Yes by proxy.
Senator Mullen?
Yes by proxy.
Senator Budd?
And yes by proxy.
Chairman Sanders?
No.
I have 14 ayes, 6 nays.
Okay, the ayes have it. The amendment is agreed to. I think we're now moving on to vote on Romney Amendment Number 1 to S 3392. I think this is a voice vote. Senator Romney, all right with you? All right, all those in favor, please say aye.
Aye.
All those opposed, the ayes have it. We're now voting on Senator Romney's Amendment Number 2 to S 3392. Once again, a voice vote. All those in favor, please say aye.
Aye.
All those opposed, say no. The ayes have it. The amendment is agreed to. Now we move to Marshall Amendment Number 1 to S 3392. Does the senator want to vote on this?
Yes.
Okay. Clerk will call the roll.
Senator Murray? No. Senator Casey? Aye. Senator Baldwin? Aye. Senator Murphy?
No by proxy.
Senator Kane? Aye. Senator Hassan? Aye. Senator Smith? No. Senator Lujan? No. Senator Hickenlooper? Aye. Senator Markey? No. Senator Cassidy?
Aye.
Senator Paul?
Not voting by proxy.
Senator Collins?
Aye.
Senator Murkowski? Senator Braun?
Yes by proxy.
Senator Marshall? Aye. Senator Romney? Aye. Senator Tuberville?
Yes by proxy.
Senator Mullen?
Yes by proxy.
Senator Budd?
Yes by proxy.
Chairman Sanders?
No.
I have 14 ayes, 6 nays.
The ayes have it. The amendment is agreed to. We're now moving to the final passage of S 3392 as amended. I move to favorably report S 3392 as amended. The clerk will call the roll.
Senator Murray? Aye. Senator Casey? Aye. Senator Baldwin? Aye. Senator Murphy?
Aye by proxy, I think.
Senator Kane? Aye. Senator Hassan? Aye. Senator Smith? Aye. Senator Lujan? Aye. Senator Hickenlooper? Aye. Senator Markey? Aye. Senator Cassidy?
Aye.
Senator Paul?
No by proxy.
Senator Collins?
Aye.
Senator Murkowski? Aye. Senator Braun?
Yes by proxy.
Senator Marshall? Senator Romney? Senator Tuberville?
Yes by proxy.
Senator Mullen?
Yes by proxy.
Senator Budd?
And yes by proxy.
Chairman Sanders?
Yes.
I have 20 ayes, 1 nay.
The ayes have it. The bill is agreed to and will be favorably reported as amended. We will now move to amendments to S 3393. We'll now vote on Braun Amendment Number 1 to S 3393. The clerk will call the roll.
Senator Murray? Senator Casey? Senator Baldwin? Senator Murphy?
Aye by proxy.
Senator Kane? Senator Hassan? Senator Smith? Senator Lujan? Senator Hickenlooper? Senator Markey? Senator Cassidy? Senator Paul?
Yes by proxy.
Senator Collins?
Aye.
Senator Murkowski?
Aye.
Senator Braun?
Yes by proxy.
Senator Marshall? Senator Romney? Senator Tuberville?
No by proxy.
Senator Mullen?
No by proxy.
Senator Budd?
No by proxy.
Chairman Sanders?
Yes.
Sixteen ayes, 5 nays.
The ayes have it. The amendment is agreed to. We'll now vote on Braun Amendment Number 2 to S 3393. The clerk will call the roll.
Senator Murray? Senator Casey? Senator Baldwin? Senator Murphy?
Aye by proxy.
Senator Kane? Senator Hassan? Senator Smith? Senator Lujan? Senator Hickenlooper? Senator Markey? Senator Cassidy?
Aye.
Senator Paul?
No by proxy.
Senator Collins?
Aye.
Senator Murkowski? Senator Braun?
Yes by proxy.
Senator Marshall? Senator Romney? Senator Tuberville?
No by proxy.
Senator Mullen?
Yes by proxy.
Senator Budd?
No by proxy.
Chairman Sanders?
Yes.
I have 18 ayes, 3 nays.
The ayes have it. The amendment is agreed to. We'll now vote on Kane Amendment Number 1 to S 3393. The clerk will call the roll.
Senator Murray? Senator Casey? Senator Baldwin? Senator Murphy?
Aye by proxy.
Senator Kane? Senator Hassan? Senator Smith? Senator Lujan? Senator Hickenlooper?
Aye by proxy.
Senator Markey? Senator Cassidy?
No.
Senator Paul?
Yes by proxy.
Senator Collins?
Aye.
Senator Murkowski? Senator Braun?
Yes by proxy.
Senator Marshall? Senator Romney? Senator Tuberville?
No by proxy.
Senator Mullen?
No by proxy.
Senator Budd?
Yes by proxy.
Chairman Sanders?
Yes.
I have 17 ayes, 4 nays.
The ayes have it. The amendment is agreed to. We'll now vote on Casey Amendment Number 1 to S 3393. Clerk will call the roll.
Senator Murray? Senator Casey? Senator Baldwin? Senator Murphy?
Aye by proxy.
Senator Kane? Senator Hassan? Senator Smith? Senator Lujan? Senator Hickenlooper?
Aye by proxy.
Senator Markey? Senator Cassidy? Senator Paul?
No by proxy.
Senator Collins?
Aye.
Senator Murkowski? Senator Braun,
No by proxy.
Senator Marshall, Senator Romney, Senator Tuberville,
No by proxy.
Senator Mullen,
No by proxy.
Senator Budd,
No by proxy.
Chairman Sanders.
Aye.
I have 14 ayes, 7 nays.
The ayes have it, the amendment is agreed to. We now go to Hassan Amendment Number 1 to S 3393. Clerk will call the roll.
Senator Murray. Aye. Senator Casey. Aye. Senator Baldwin. Aye. Senator Murphy.
Aye by proxy.
Senator Kane. Aye. Senator Hassan. Senator Smith. Aye. Senator Lujan. Aye. Senator Hickenlooper.
Aye by proxy.
Senator Markey. Aye. Senator Cassidy.
No.
Senator Paul.
No by proxy.
Senator Collins.
Aye.
Senator Murkowski. Senator Braun.
Yes by proxy.
Senator Marshall. Senator Romney. Senator Tuberville.
No by proxy.
Senator Mullen.
Yes by proxy.
Senator Budd.
Yes by proxy.
Chairman Sanders.
Aye.
I have 17 ayes, 4 nays.
The ayes have it, the amendment is agreed to. I will now vote on Marshall Amendment Number 2 to S 3393. This is a voice vote. Is that all right, Senator Marshall? All those in support, please say aye.
Aye.
All those opposed? The ayes have it. All right, now we're up to final passage of S 3393. This is final passage. I move to favorably report S 3393 as amended. The clerk will call the roll.
Senator Murray.
Aye.
Senator Casey. Aye. Senator Baldwin. Aye. Senator Murphy.
Aye by proxy.
Senator Kane. Aye. Senator Hassan. Senator Smith. Aye. Senator Lujan. Aye. Senator Hickenlooper.
Aye by proxy.
Senator Markey. Aye. Senator Cassidy.
Yes.
Senator Paul.
Not voting.
Senator Collins.
Aye.
Senator Murkowski. Aye. Senator Braun.
No by proxy.
Senator Marshall. Aye. Senator Romney. Aye. Senator Tuberville.
Yes by proxy.
Senator Mullen.
Yes by proxy.
Senator Budd.
Yes by proxy.
Chairman Sanders.
Yes.
I have 19 ayes, 1 nay.
The ayes have it. The bill is agreed to and will be favorably reported as amended.
Mr. Chair, I have a parliamentary inquiry.
Yeah.
If we could return to S 3392 and Marshall Amendment Number 2, the anti-Semitism amendment.
Yes.
That one passed favorably, I think, by a vote of 14-5 or 14-6 with the word allow. I think some voted for the word allow even though they preferred promote, and some voted against allow because they preferred promote. I think it would be likely be a fair reflection of the committee's will on this if we were to be able to vote for the amendment with the word promote rather than allow. And so I wanted to ask a parliamentary inquiry, recognizing that we've gone through the bill, voted on the amendment, final passage, but we're still here at the table. Might we contemplate a procedure where we could substitute the word promote for allow and then have a revote on the amendment and then a revote on final passage of the bill as amended in that request?
Senator Kane, as I understand it, that would require unanimous consent. And
I would ask unanimous consent.
I would object.
Do you have object?
All right, say again, I'm sorry, say again what you...
My request would be, since I think a lot of the votes were sort of depending on whether it was allow or promote. Some colleagues voted yes to allow but preferred promote. Some voted no to allow because we preferred promote. I think it'll be a stronger vote in terms of representing the will of the committee if we actually vote on the amendment with the word promote rather than allow. So my request is that we re-vote on Marshall 2 amending the word allow to promote, that we revote on that amendment and then revote on final passage of the bill subject to that amendment.
Discussion.
We have a quorum, but we don't have proxy votes. And I think I know where my proxies would be, but I can't speak for them without a proxy. I'm just saying that because that's kind of a
Well,
congressional skirt.
all right. My difficulty here is, I hear where Senator Kane is coming from, and I think the word promote is a much stronger word than allow. I do think that this really still raises the complexity that Senator Romney indicated earlier, and I would prefer to not have to vote on it now, but you've already got your vote and it passed. So the quandary that I'm in, promote is a stronger word than allow. It passed. You agree with promote?
Yes.
Senator Marshall? I do. All right, so I am not crazy about this, but I will support the effort to replace the word allow with promote.
I would ask for a voice vote on the amendment.
Any objections? All right, all those supporting a voice vote on the amendment, please say aye.
Aye.
All those opposed? The ayes have it.
And then, Mr. Chair, do we need a vote on final passage with the, because we have altered that one word in Marshall Amendment 2? Do we need to
No, we
revote
don't
on final
think-
passage?
Our distinguished attorneys say no.
Okay.
All right,
Since they're distinguished, that's great.
all right. I don't think so.
Yes, you do.
You're-
Yes, you do, to show up.
The agreement now is to take the amendment, and we're going to attach the amendment that promotes instead of allows, correct?
Yes,
That's where everybody is?
and passed unanimously.
It's going to override.
You've been overriding your first vote.
But you have to redo the final
But
passage.
parliamentary inquiry, Mr. Chair?
Yeah.
The parliamentary inquiry is this: several of our colleagues voted no because of, oh, I see, it doesn't matter on the final vote because you voted for passage of the bill, Senator, didn't you?
I
You voted-
also, Mr. Chairman, on the parliamentary, my parliamentary inquiry is voting no because of the word that had not been changed in the amendment. Now that there's a voice vote to change the amendment, I did not hear unanimous consent for our votes to be recorded as ayes. And if that's not the case, I would ask unanimous consent to be.
We'll be on the safe side and accept your amendment. I don't think it's necessary, but we will bring that to a vote. Discussion. Yeah.
Again, I have to represent my down dais members who thought that this was settled and who have left. I just want to raise again that I don't have proxies for them, and nor have they had the ability to consider. This is kind of late-breaking news.
Senator Romney.
Senator Cassidy, didn't they all vote yes? I believe the on-ballot members all voted yes. So it wouldn't be an issue.
Do a voice vote again?
Well, we've already acted and we've passed. I think Senator Paul was a non-vote. Was a non-vote or no? He was a non-vote.
I think we could solve this problem by once again doing a voice vote. And people who are not here will not have voted on it.
Wait, we already did
What?
the voice vote.
But voice vote on Lujan. I think we do a voice,
But we're overriding the amendment. We're changing the word on the amendment.
But we've already voted out the bill with the amendment being in.
So do we want to vitiate the amendment or re-vote on this? I don't think we need to because we haven't reported anything. We're still in the middle of the markup.
Well, we reported the bill with a set of language. And now we're changing the language after we've reported the bill.
So you have to re-vote on the base. So re-vote on final passage with promotes included now in the, in the Marshall.
We don't have proxies for that for our members.
Yeah, but you could do it by voice vote.
We can't report it out by voice.
Yeah.
Okay.
you cannot record it out by voice?
No, not the
So you have to revote the whole thing?
Well,
All right, let's move it along.
proxies don't count on final passage anyway.
Good point. All right, so we're right.
Occasionally, I have one, Mr. Chairman.
What? What do you propose? You want another vote or what? Come on, let's go.
I would propose unanimous consent to just pass that bill as amended.
All right, I would propose that we pass this bill with the recent change of language. All right, is that all right?
Do a revote on final passage with the new word promote.
All right, what do you want, to revote?
Revote.
All right.
Roll
Well,
call vote with the word promotes is in Senator Marshall's amendment. We voice voted the amendment adding promotes. We'll now vote on final passage with the new amendment incorporated and the other amendment vitiated.
okay. Clerk, call the roll.
Senator Murray?
Can I say just one more thing? Can we actually, so maybe the staff members can call their members who are not here and get their feeling on that? Can't we have another final passage to do? Can we do that?
Mr. Chairman, I ask unanimous consent that you do the roll call vote and that we hold the vote open for 2 hours for any member who's not here to be able to vote correctly.
All right. See, that's what happens when you chair the Appropriations Committee. You come up with all these brilliant ideas. All right, I agree with Senator Murray. Okay, let's, final passage, clerk, call the roll.
Senator Murray? Senator Casey? Senator Baldwin? Senator Murphy?
Aye by proxy.
Senator Kane? Senator Hassan? Senator Smith? Senator Lujan? Senator Hickenlooper?
Aye by proxy.
Senator Markey?
Aye.
Senator Cassidy?
Aye.
Senator Paul?
Not voting.
Senator Collins?
Aye.
Senator Murkowski? Senator Braun?
Not voting.
That's not voting.
He's just not here.
Senator Marshall? Senator Romney? Senator Tuberville?
Not voting.
Senator Mullen?
Not voting.
Senator Budd?
Not voting.
Chairman Sanders?
Aye.
We will keep that open for 2 hours and let members.
Right. And again, let's be clear, we're going to keep the voting open for 2 hours for those who have not voted. All right, clerk, ask me.
Chairman Sanders?
Aye.
I have 16 ayes, 0 nays.
All right, where we are right now, what's the vote, where we are right now?
16 ayes, 0 nays.
Okay, and we will keep the vote roll open for 2 hours. All right?
We still have final passage.
All right. Next vote is on final passage of S-640 as amended. I move to favorably report S-640 as amended. The clerk will call the roll.
Senator Murray? Aye. Senator Casey? Aye. Senator Baldwin? Aye. Senator Murphy?
By proxy.
Aye by proxy.
Senator Kane? Aye. Senator Hassan? Aye. Senator Smith? Aye. Senator Lujan? Aye. Senator Hickenlooper?
By proxy.
Aye by proxy.
Senator Markey? Aye. Senator Cassidy?
Aye.
Senator Paul?
Aye by proxy.
Senator Collins?
No.
Senator Murkowski?
The opioid treatment.
Senator Braun?
Aye by proxy.
Senator Marshall? Senator Romney? Senator Tuberville?
No by proxy.
Senator Mullen?
No by proxy.
Senator Budd?
No by proxy.
Chairman Sanders?
Aye.
I have 16 ayes, 5 nays.
The ayes have it. The bill is agreed to and will be favorably reported as amendment. All right, I now move to authorize staff to make any required technical and conforming changes when preparing S-1840, S-3392, S-3393, and S-644. All those in favor say aye. Aye. All those opposed say no. The ayes have it and the motion is agreed to. That concludes the vote, and that's all of our business today. And thank everybody for their efforts. The committee stands adjourned. I'm sorry.